The COVID-19 pandemic over the last 2 years has caused delays in the implementation of our programs, particularly the community interventions. COVID restrictions and the lockdown meant that our team was unable to organize any outreach or movement. However, this did not completely stop us from serving our beneficiaries and implementing the planned activities. What we had to do was adapt, finding new ways and innovations to ensure that the targets set were accomplished.
I'm excited to report to the board that this half year from December last year to this June, our staff and our teams have been able to achieve tremendous results.
In the last 6 months, SFH, in partnership with the Ministry of Health, RBC, local government and community stakeholders, effected various interventions aimed at promoting and improving the health of the Rwandan people. Here are some of those interventions and their impact. Adolescent sexual reproductive health and teenage pregnancy are now a public concern and will continue to affect the country's development if nothing is done.
In terms of sexual reproductive health, we have reached to over 60 schools, over 90 pharmacies. We are working with different outlets to be able to educate, to provide educational materials. And we have seen tremendous results because it is about education, it is about sensitization, it is about mentoring, it is about coaching, it is about guidance, because youth normally make uninformed decisions. When we provide them with materials, with counseling, with mentorship, they are able to make informed decisions.
SFH is implementing an ASRH intervention both in and out of schools to empower young people and their parents, equip them with skills and knowledge around sexual reproductive health and rights, teenage pregnancy, and prevention of HIV and STIs, as well as drug and alcohol substance abuse prevention. The in-school program is already contributing significantly to ASRH information and services. To date, 306 teachers have been trained to facilitate dialogue through school clubs. We have 64 focal points from HC in place who are trained to improve the linkage of ASRH services. In addition, 200 students also trained as school ambassadors and peer facilitators to disseminate the right information and education to their fellow students in their respective schools. In the out of school, we engage parents and young people to speak freely about ASRH information and education in what we call Parent-Adolescent Communication Park Sessions. The park strategy is to improve the communication between parents and their adolescent children, especially about sexual and reproductive health matters. We have also been able to train 543 young people in 7 districts who provide ASRH information, education and services at the cell level.
It is an exciting time to report to the board that despite the COVID challenges, we have been able to see tremendous successes. The numbers you see on the screen, the numbers you see in the report really came as a result of great collaboration with our partners and with our tremendous staff who courageously go out despite the challenges and restrictions of the COVID and movement problems, but they are able to really fight hard.
SFH continues to support government's efforts to achieve universal health coverage by constructing and equipping health posts and supporting its operations under our target of healthcare system strengthening.
We have been able to construct, equip, and operationalize 10 health posts stretching from Burera to Nyagatare, whereby we have been able to cut the cross-border movements of people, especially looking for services. It is now exciting to report that each of these health facilities we have constructed, equipped, and trained staff serves over 7,000 people. And we see on a daily basis about 100 people attending to this. And all these people receive medication, receive treatment, receive care, and receive guidance.
Malaria eradication in Rwanda is only possible when communities are fully engaged in program implementation. In addition to the distribution of malaria prevention products countrywide, SFH has successfully implemented the social behavioral change communication for prevention in the Eastern Province. 118 community health workers have been trained and now closely working with healthcare providers from health centers to support the program's implementation. Members of the community and local leaders have been engaged to identify malaria hotspots, address the barriers to change, and adopt desired behavior around malaria prevention and control. SFH, with support from SC Johnson, have been involved in the Great Lakes Malaria Initiative. A strategic plan has been developed and approved by the AEC and DRC country members, along with our partners. SFH is establishing the malaria prevention and control program in other countries using Rwanda's best practices. This initiative will contribute significantly to the country and the region's target of eliminating malaria. In the fight against the spread of COVID-19, SFH, together with its partners, continues to provide technical and financial support to government through the Ministry of Health and RBC.
We have had tremendous also achievements. We have reached to over 20,000 community health workers, equipped them with sanitizers, with thermometers to be able to measure temperatures, to be able to do the preliminary screening. It is really very good.
This support has contributed considerably in community awareness and education, as well as surveillance. 1,000 CHWs from 10 border districts have been trained to support in COVID prevention through education and home-based care for active cases and contact tracing at a community level. The successes we were able to achieve include all 1,000 CHWs were provided with personal protective equipment, including thermometers, face masks, hand sanitizers to protect themselves and others during home visits. Over 77,000 HHs were visited. 374 suspected cases were monitored for a period of 14 days. 226 cases were monitored by the CHWs and all recovered.
Our tremendous staff who, despite the challenges of COVID, we are very, very much hardworking. They did not fear the risk. Of course, they took preventive precautions, but we are very successful. The numbers you see on the screen and the PowerPoint and in the report is a result of a big effort, of big sacrifice, and I'm eternally grateful.
In line with promoting social behavioral change through communication and working closely with various stakeholders in the broadcast media, SFH Rwanda issued the Health Story of the Year Award at the recent Development Journalism Awards 2021 held in Kigali.
So I really want to thank you. And as you definitely can see in the rest of this video, the testimonies of different people, the numbers, these numbers came as a result of our committed staff. We don't have a big staff, but our staff are quite committed, and our grassroots approach is really tremendous and generating results that are really exciting. I thank you so much.
The dedicated staff at SFH continue to serve the people of Rwanda and beyond. We remained committed to reaching those who are in need but hard to reach, to ensuring that health products are available and accessible to all Rwandans, and committed to seeing the quality of life in our communities improve from generation to generation.